Hello, this is Dr. Jamoli from OMS of NY. We have been getting a lot of questions about tooth extractions. I'm here to answer some of the most common ones. Dental extractions are basically tooth removals, and when the teeth are not salvageable, they have to be removed. Tooth extraction is recommended when the tooth has gum disease or fractured or has severe cavities. A dentist will recommend tooth extraction versus root canal when they feel that saving the tooth is not possible and the teeth needs to be removed. A dentist can remove the infected tooth. In fact, they should remove the source of the infection as soon as possible. And I know some dentists like to wait and give antibiotics before extraction, but I think this is wrong, and the tooth should be removed as soon as possible. Tooth extraction is necessary for braces when the orthodontist feels that they need space in the arch and there's not enough space. They remove the teeth to create that space to move the teeth around. Necessity of removing wisdom teeth depends on the age and depends how well the patient can maintain the hygiene. Usually, most of us do not have room to keep the wisdom teeth, or sometimes not enough room to even have them erupted. So therefore, when they're not erupted, they cause problems for the teeth next to them, or they cause infections. When they're erupted and we do not have space, then we can get cavities, and eventually you will have to refill them after a few years. And I believe that is not worth the expense or the headache. If you're thinking about removing a tooth and you don't know where to go, whether to go to dentist or oral surgeon, you should do your basically homework and see how skillful your dentist is, how comfortable they are, and what their experience has been with removing wisdom teeth. In general, wisdom teeth are best removed by oral surgeons because this is what we do every day. And therefore the complications and post-op pain is reduced. Periodontal disease can be cured by removing the tooth. Periodontitis is basically disease of the tissue around the tooth. And when you remove the tooth, that disease is gone. Tooth extraction is necessary before dental implant surgery, but in my office, we try to maintain and keep all the teeth that we can. Nothing will replace your own teeth. But if the tooth is fractured or has severe cavities or is just not salvageable, we have to remove it and place the implant. In my office, we place the implant that day. When you come in for removing of a tooth, you should expect basically some pressure and some noises. In my office, we recommend putting a headphone or some music on, but you will feel no pain. I guarantee that in my office. I tell the patient to raise their hand if they feel pain, and we stop, we give you more Novocaine. And also another option that we offer is IV sedation, where you will be sleeping. Bone graft is necessary after tooth extraction to maintain the volume of the area. If you lose the volume, then you cannot put implant in future. Tooth extraction should not be painful. Basically, in our office, we make sure you're not in pain during the procedure. Afterwards, of course, you will have some soreness, which are controlled by the medications that we send to your pharmacy. Options for anesthesia for tooth extractions include from local anesthesia, which is Novocaine, to all the way to IV sedation, and then occasionally, once or twice a year, general anesthesia. This is for severe anxiety patients that cannot handle IV sedation and need to be in hospital setting. But typically, oral surgeons in America, they perform IV sedations 4 or 5 times a day, and it's very safe. Dentists give pain medication after tooth extraction. Some dentists like to jump to narcotics, and some don't. In my practice, we tend to stay away from narcotics and keep it for absolute last resort. The length of time for healing after tooth extraction, it depends on the skills of your oral surgeon, the age, the difficulty of the tooth extraction, and whether or not you have systemic disease or you're a smoker or not. But typically, It's a process. It takes about, I would say, 10 days to 2 weeks to close the hole completely. But first couple of days, a little bit soreness, and it will get better and better afterwards. What helps the tooth extraction site to heal faster is following my instructions, basically. Not to smoke cigarettes, no drinking alcohol, no exercise. Staying on the liquid diet and soft food helps tremendously. You can minimize bleeding after tooth extraction by biting on the gauze gently for 45 minutes and keep the talking and the body movements to minimum first 24 hours. Lost blood clot after tooth extraction is when you lose the blood clot in the socket. Basically, when you take the tooth out, blood clot forms automatically, and that starts the healing process. When the blood clot is lost, then you may experience severe pain. You can avoid dry socket after tooth extraction by following the instructions very carefully. We recommend no using straws for 10 days, no exercise, and no smoking for 10 days. Do not drink alcohol for 10 days, and rest. Some of the other precautions that you should take after tooth extractions are no smoking, no exercise, stay on a softer food for 2-3 weeks, and brush gently, keep the mouth clean, and just keep the talking minimum first 2-3 days. Resting period after tooth extraction depends on the severity of the extraction. If they are multiple impacted wisdom teeth, yes, you would need to rest for a couple of days. And when you go back to work or school, keep the talking to minimum, keep the walking to minimum, and basically keep your heart rate down for 10 days. Tooth extraction cannot cause speech issues or speech impediment. You can talk and speak right after. However, we like you to keep the talking to minimum first few days. You can schedule the tooth extraction procedure when you're in pain or when your dentist has referred you to an oral surgeon. This is Dr. Jamali, and I hope I have answered some of the questions about tooth extraction.